Welcome everyone to today's webinar. I think we're having a little bit of technical difficulties here. I think with everyone kind of in the world using GoToMeeting and such. So I apologize for any of that. But today's webinar, 5 things you can do right now to stabilize collections during challenging times. We know your time is more valuable than ever, so we'll do everything we can to make the time you're spending with us as valuable as possible. We're going to begin today's webinar with a presentation. And hopefully we'll have time after the presentation for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. And today's session is being recorded and will be emailed to you following the event. If we are unable to kind of get to any questions, again, you can send them all to info@collectrx.com. And Franklin and I will be happy to kind of answer those for you. So at this time, just kind of wanted to introduce us. So my name is Pat O'Connor. I'm the Vice President of Business Development and Account Management here at CollectorX. I've been here 7 years, starting on the operations side of our business and now coming over to the client side. And I'm also joined here by Franklin Smith. Franklin?
Yes, thanks, Pat, and hello to everyone out there and what I'll call revenue cycle management land. I want to thank you guys for joining the webinar. I've been with CollectorX 3 years as of April the 3rd. So I've come up on an anniversary date of being here. I'm very excited. I serve as Director of Revenue Cycle Solutions for the company, and today I'm thinking that Pat and I will be able to add some value to your day to help you through this COVID-19 experience that we're all going through.
Great, thanks, Frank. All right, so today we're going to cover several big topics, which kind of include the following: appeals, out-of-network underpayment denials, reviewing AR for all claim types to uncover uncollected reimbursements, understand what the payers are doing, being able to pivot and supplement your practice, and leveraging the CARES Act and other federal, state, and nonprofit grant relief programs. So to get started, before diving into these topics, I wanted to provide kind of a quick summary of our experience in collection, payers, and out-of-network, so you understand why we're in a position to address these issues. Despite our name, CollectorX has nothing to do with the pharmaceutical industry. Simply put, what we do here at CollectorX is help providers get higher reimbursements on in and out-of-network bills and maximize their payer collections. Now, we don't do this as consultants, but as actually experts in negotiating and appealing in order to achieve higher reimbursements on your bills and collections. CollectorX was founded in 2006, and since then we've been singularly focused on helping providers get higher reimbursements. During this time, we've helped more than 2,100 providers nationwide optimize their reimbursements for in and out-of-network claims. We do work with a variety of provider types, including ambulatory surgery centers, physician groups, hospitals, labs, behavioral health. We've worked with some DME providers, some telemedicine, et cetera. The list continues to go on. Now, the biggest differentiator that allows us to get the results we get is our proprietary business intelligence system, CRIXIS, which stands for the CollectorX Information System. Now, this is a data analytics and workflow tool that we've developed to support us as we go toe-to-toe with payers. CRIXIS helps us analyze insurance policies, provides comparable data, and allows us to track the tendencies and trends of the people on the insurance company side. In addition to CRIXIS, we rely on our expertise. We've built a unique team of experts who used to work for insurance companies and their vendors, which then puts us in a unique situation to kind of understand the soft spots in the payer's position to get the higher payments on bills for our customers. So with the background stuff out of the way, let's get into why we're here. So COVID-19 has put tremendous strain on healthcare providers. The focus on fighting the coronavirus has caused volumes of other types of patients to plummet as elective surgeries have been kind of banned across the country. According to a recent survey, patient volumes at this point are down 65% and will likely remain at that depressed level at least until the end of this month. Now, while we all expect the volumes to rebound in time, it's certainly going to be very slow. At the same time, more than half of patient encounters will be through telemedicine through the foreseeable future. And while that helps some practices in the short term, many doctors are considering furloughing or laying off employees. So there's a lot of pressure here, and that's where we're going to kind of get into ways to kind of reduce some of that for you. So the first step is let's talk about appealing out-of-network underpayments and denials, specifically looking kind of at the last 12 months to try to figure out how you can help there. So, this may seem like an obvious recommendation, but going back over your out-of-network claims and reviewing them for underpayments and denials is one easy way to supplement your cash flow right now. Since these are non-contracted claims, it's a key area to focus on to increase your collections. At CollectorX, we deal with these payers every day, and we can tell you that they've become much more aggressive on these out-of-network claims in the past year. So the chances are pretty good that you've been underpaid on many of them. So on this slide, I have kind of an example here. So suppose your facility generates, $5 million in net revenue, with 15% of that coming from out-of-network patients. In a typical scenario, CollectorX can increase a provider's allowables by 1/3, meaning the payer is going to increase the usual and customary amount by 33%. So in this specific scenario, that would mean an additional $250,000 in reimbursement and profit. Put another way, suppose you were in a contract with a major payer who just comprised a small portion of your business. If they offered you a 33% increase in your reimbursement rates, you'd be thrilled, right? So that's the size of the opportunity we're kind of talking about here. So next I want to talk a little bit about the out-of-network game. The first thing to know is that payers are always looking for ways to control costs, i.e. the amount that they pay out to you, the providers. One strategy insurance companies use is the outsourcing of the bill minimization tactics to third-party vendors that specialize in helping payers reduce payments to providers. And they do this through two main ways. One, through kind of upfront negotiation services, and two, through repricing services. So you may have heard of these types of companies, the MultiPlans, Viant, NCN. There's hundreds of them out there. It's vital to understand that these are cost containment companies that are employed by the insurance industry to literally contain their costs and reduce payments to providers. Do yourself a favor. You can even venture over to the websites of any of these companies, and you'll see it all laid out there. They're not even hiding what their purpose is. In fact, if you look at their list of clients, again, you're not going to see any providers listed as their clients. All their providers are the insurance companies. So the goal for them is to maximize the discount. Why? Because that's how the vendors make money. The vendors are compensated on a commission basis. So the greater the discount they're able to provide to the insurance company, the higher commission that they receive. So the next couple of slides can show you you can have significant success when appealing underpayments and denials and what this can mean to your facility or practice. On average, CollectorX obtains an additional payment on 60% of the workable claims and then increases the initial payments by 87%. What this means is that if you were initially paid $1,000, on average, we're able to obtain an additional $870 from the insurance company. So here's just an example of one of our clients that's out of network with Aetna, Cigna, United Healthcare, Assurant. In this example, we found 73 cases to appeal over the last 12 months, and we were successful on 45 of those, generating another payment. Bill charges were $1.6 million with total initial payments of $363,000. Using Crixus and our appeals process, where we were able to pay an additional $314,000 in additional payments. I show you these examples as just to, again, really hammer home the fact of how much opportunity is really there to kind of generate revenue during this time period. Now, whether you use CollectorX to help you with appeals or attempt to do them yourselves, there are some specific steps you can take that will significantly increase your chances of getting additional payments. And I want to kind of go over these kind of step by step to give you guys some of this information. The first thing you have to do is to maintain a rigorous appeals process. And when I'm talking about appeals, these occur when a payer has repriced a bill at a low amount, and you're trying to re-engage the payer to make a second payment. From the insurance company's perspective, they're done with the case. They made a determination of what was reasonable and customary, or, frankly, their third-party vendor made that determination for them, made a payment, and now it's up to you to change their minds. So this is a very labor-intensive process to appeal an underpayment and obtain a higher payment. And here are some of the steps to kind of follow. So step one is kind of the initial intake. You need to ensure you have the documentation necessary to handle the claim. So this includes the UB or 1500 form, the EOB, which is going to show you how the claim was processed, the assignment of benefits or kind of a patient auth form, and then any billing or collections notes. Step two is the payer verification. You need to contact the payer to verify the patient and bill information and obtain a verbal explanation for the basis of the reduction. So it's very important to make that initial call so you can try to figure out what the issue is, why the claim was paid in the way it was. Step three is the strategy development. You have to devise an appropriate strategy for the claim based on kind of what you found out during step two of the process. So this involves formulating the facts and arguments to be made. And of course, we use our CollectorX business intelligence engine to assist in this process. Step four is payer engagement. You want to engage the payer and present the relevant facts and arguments to the payer. It's very important when you do this, though, you follow two parts of this process. One, you have to use data here to show the payer how they should have processed the case. And two, you have to be persistent. To be successful with appeals, you need to be able to call every day. You need to be able to write letters, escalate when necessary, even at times to the state insurance commission, for example. This process can be arduous and can take a lot of time. It can take as little as 6 weeks, but more than likely, it has the potential to go 6 months or more. The payers are just counting on you to give up and move on. Then finally, step five is kind of the settlement agreement and follow-up. So not surprisingly, payers don't always pay on time and the correct amount. So when you're actually successful on negotiating and increasing the allowable with a payer, you need to follow up with the insurance company to make sure you actually get paid and paid correctly based on what you were able to get through the appeal. Okay, so I mentioned this briefly before, but it's vital to obtain the data to prove that the insurance company's payments are inadequate. You're going to need to be able to argue that the insurance company's reimbursement level is inconsistent with your own history and preferably the history of other providers in the community kind of in your same range. So, I attached a screenshot here of CollectorX that shows kind of how we use real-time comparable data and analytics to show where the allowable should be. We break down our data by payer, plan type, geography, specialty, and many more data points. The circles above indicate specific cases that can be drilled down to use for comps and learn the success of other negotiations similar to yours. Now, again, even if you don't have the CollectorX information, you should be able to gather a ton of information from your internal system. And again, you want to look at not just comparing United Healthcare case A to United Healthcare case B. You really need to get down into the employer group of each of those cases and the type of plan inside of the United Healthcare plan, just knowing that just because it's the same payer doesn't mean it's the same comp data. Just some other steps to win some appeals. number one, reading and understanding your EOBs is so important. And this is kind of easier said than done, as the EOBs are often difficult to decipher, really by design from the payer. So, I mean, even if you only take one thing away from today, it's to check your EOBs, because if you don't check them, frankly, you're losing money. Similarly with respect to the assignment of benefits, you got to have a well-drafted AOB that includes, the following. It has to assign the right to appeal and the right to receive relevant documentation and payment to the provider. It has to refer to the provider as the patient's authorized representative, and it should properly reference ERISA and a full and fair review of claims. Next, negotiations. When vendors opt to settle a case through negotiations, they often do so by sending proposals that kind of have these short turnaround times. So it's important when you look at this stuff that you act on them quickly, knowing that you may not have a second chance to get the deal. Another thing to be cognizant of is third-party contracts. These third-party vendors will sell contracts to providers that promise these great rates. The catch, and what they don't want you to know, is that they're applying various cuts kind of after the contract, multiple procedure reductions, contracts based on allowable or allowed charges rather than billed charges, and a lot of providers don't even track their payments to see if they're actually being paid correctly per these contracts. So, you have to remember that these vendors work on behalf of insurance companies to save them money by reducing payments to you. Knowing that, any contract you sign with them is really a cap on your reimbursement and really savings to the payer. It's also very important from a persistence. I know we talked about this a little bit before, but who's going to win the battle of the wills? The payer and vendors put up obstacles to success. Banking, again, that you're just going to get up and walk away. Their goal, their sole aim is to get you to throw in the towel. They know you're busy. You might have hundreds. Some providers have thousands of claims. They keep racking up month after month, and they're just hoping that you're just going to give up and they'll just kind of move on. The last thing I want to mention, and we've mentioned a couple times, is just remember that the payers and vendors are not your friend. We hear providers say all the time that they have a great relationship with, Susie over at the vendor. And that's exactly what they want you to believe, that they're doing you a favor by giving you such a great rate on this claim. So make sure to give them a great rate on the next one. Remember, these vendors are not your friends. They are compensated on how much money they save their clients, who are the insurance companies, which again, they're constantly looking for ways to pay you, the provider, less money.
That's an excellent point, Pat, you make about these insurance companies not being our friends. Their best interest is not our best interest, and it tickles me sometimes when we hear that story about the relationships that providers think they have with their payers, and then we're able to show some of our results, and that changes quickly. So let's go ahead and talk about what we can do with our outstanding AR, which is one of the biggest assets that each one of our practices have, and we need to do the best we can to turn that receivable into as much cash as we possibly can. Challenge of getting the highest reimbursement possible for your charges has never been more daunting. Even prior to the current challenge of COVID-19, the payers and insurance companies have executed a campaign to reduce payments for as many encounters as possible. The slide here shows how that plan is being executed. I think Pat did an excellent job of explaining some of the games our network providers have to participate in to get the desired dollar we want into our banks. In addition to his points, payers continue to challenge providers through revenue leakage in the form of denials. The additional work required to resolve or respond to these deductions have forced many billing and collection operations to consider how or whether or not we even want to address it or can afford to address it. Is there real value in paying attention to your denials? But we at CollectorX say you have no choice but to do so. Many billing operations that we come across share the key reasons why appeals of denials often go unaddressed, and many times it leads to low cash flow and a lot of cases reduction in operations. The expertise needed to reduce overturns do require specific skill sets, negotiation skills, data gathering, and retention of that data, the way Pat talked about, and trending it from a historical perspective are all bullet points to success that providers need to have in place when they choose to appeal. The overwhelming majority of you do not have that skill set within your team. Form letters make us feel comfortable that something is being done, yes, but the real work it takes to spur more cash is not easily recruited. And when we find that right person for the role, often it's very expensive and it costs a fortune. So all of these barriers are to be overcome when deciding to move forward with an appeals program. Right now, actions can be taken to enhance your cash flow in the midst of this COVID-19 experience. Some of us will have more low-hanging fruit than others to help drive cash flow for the next several months. Others of us, all of our low-hanging fruit, if you will, is a challenge because we haven't been able to address anything in our shops. So let's try to help drive you to some key areas to address right now. For instance, your legacy AR. There are certain statuses that are more payable than others. If you have any accounts where we've gotten a promise of payment, or where you've validated that the insurance claim is with the payer, or you've sent the additional information that they requested to them, follow up on those accounts to see whether or not they've been paid and become that squeaky wheel if they have not, to push that cash through. The next set of statuses you might want to pay attention are your recent rebills that were sent out, or any claims that you recognize during the follow-up process that are not on file. Let's make sure we get those claims to the payer so we can get our cash quickly. On your current AR, ensure all claims are at least received again, and obviously any that are not are rebilled. Review your 835. You have additional information requests or underpayments that show up on there, and you have the ability to work those to increase your reimbursement or to save revenue from leaking due to some technical issue or denial. Of all the payer passion we are seeing during this period on what is being waived or forgiven, or the payers trying to help us, we don't hear much about timely filing being forgiven for claims that are not related to the COVID-19. So let's be sure to document all appeals and all work performed, and anything that you send in the mailing system, make sure you can track it in some way in terms of the receipt of the packages that were sent to the payers and their signatures verifying that they received it. Listen, there will be major backlogs in all of this, and those providers who have documentation of their actions will be rewarded with overturns, while those who do not document will face huge challenges trying to save revenue or enhancing payments through appeals.
Great points, Frank. One question I had, so would you give people kind of an example of kind of a line in the sand from a timing perspective on kind of how far back they should go, where they can legitimately find cases that can pay for them?
Sure, absolutely. Again, with those statuses that I mentioned in the beginning, it does not matter the agent of those particular status, which is why you want to attack those first. Once you've attacked those collectible statuses or those statuses that could turn into cash real quickly, you want to protect your new revenue. You want to look at your accounts between the ages of 0 and 60 days. Again, making sure that they're at the payer, making sure that the payer has acknowledged them as received, so we will have no timely filing issues down the collection path, if you will. So I would definitely work those statuses that I talked about first, and then come back working newest to oldest all the way through, saving your most revenue, which is your current your current AR.
Perfect.
All right. So, in order to collect and be successful, we need to understand what the payers are doing and some of the strategies we need to implement to offset anything that might be damaging our receivables. So, we're going to talk about that right now. Okay. CMS is reminding hospitals that they have the ability to request accelerated payments in trying times that affect their ability to operate, which we all are appreciative about. The really awesome news, though, is now, through the duration of the public health emergency, the opportunity to assist with cash flow has also been expanded to a broader group of providers, us. Rules have nuances, if you will, per MAC. So you have to review how your MACs form and the information you need to submit based on their requirements you need to make sure you're compliant with. But generally, what you see on this slide is what is required to participate in the program. Keep in mind, it's a loan, and future transactions will be retracted until the balance is paid in full. So there's been pressure on commercial payers to follow suit with this also. However, to date, CollectorX has not seen any payers necessarily willing to pay up front outside into committing to speed up their claim processing as much as humanly possible.
Yeah, I mean, it would definitely be it'd be great if we start to see a little bit of that. But yeah, I mean, I agree, Frank. We haven't really heard much about any of the commercial side doing that. I mean, it's great what Medicare is doing. You know, you can get 100% of your kind of your Medicare payment amount for a 3-month period. So this could really help providers, you know, stay afloat during these tough times. So it's just another way to keep afloat. Now, to Franklin's point, doesn't mean spend all the money you have, because it's going to get kind of paid back later when you actually have those patients. But it's definitely a good bridge, in these tough times.
That's exactly right. Provide cash flow. And that's what we need in order to keep our businesses open. So if you haven't gone out and apply for that, please do so. Right after this call, the forms are not that complicated at all to complete. And if you're a Medicare provider and you meet the requirements that Pat has spelled out, then absolutely you should be requesting those funds. So our states and their governors have been very active when it comes to protecting the electorates around the COVID-19. This slideshow, as of April 14th, shows how they have issued orders to help eliminate virtually all of the out-of-pocket expenses for patients. The protections also offer relaxation mandates on requirements or utilization management requirements for inpatient stays. This also eases the administrative burdens for hospitals and providers that are accepting COVID patients. Some of the states have even ordered payers to relax their, wait for it, timely filing issues for claims and appeals to allow business office operations to return to a normal state. But again, some of these rules and some of these mandates that have been placed out there, the vast majority of them are pertaining to COVID-19 cases. They're not necessarily expanding these timely filing rules for all types of conditions, if you will. So our providers need to pay attention to that. Okay, let's be careful.
Yeah, and then to your point down below, and the kind of the out of network providers, being careful when billing patients, because yeah, I mean, the media may be kind of all over it.
Do not want to be on News Channel 7 or whatever your local news is that has the highest rating trying to explain why a patient got a surprise bill with the COVID-19 diagnosis. That's the last thing we want our practices to be going through, Pat. You agree?
I completely agree. Which is, I mean, it's so important to, kind of engage the patients, whether it's COVID-19, or any other situation, when they're there in the facility, talking to them, letting them know kind of how it works, so that they're fully engaged in the beginning. They understand what their portion is going to be and what their portion is not going to be, so that people are on the same page up front, so that no one feels like they're kind of bamboozled in the end, and that's when you really get into those sticky situations.
Yep. So in the end, blocking and tackling of patient transparency still applies. Let's have conversations with our patients about the out of pocket. If it's COVID-19 related, I strongly suggest that we do not bill patients at all for those particular conditions, and to take the lead of some of the payers and some of the government um, agencies that are waiving any out of pocket as it relates to COVID. Okay. Now, in response to state initiatives and independently, payers have undertaken some initiatives to support patients, and in some cases, providers during this time. Let's visit AHIP's website for a complete breakdown of each payer. But I can provide you with some of those examples right now. For instance, United Healthcare, Humana, Aetna, all are fast tracking claim payments, they say, to medical and behavior care providers. In addition, the same three payers are relaxing some of their prior authorization and utilization management rules that they have in place. And we've all seen the expansion of telehealth initiatives, and they're relaxing rules statewide in terms of who can see patients and why. Now, there's still some strong state stipulations that are out there, but for the most part, these are being relaxed to enhance patient access to care.
Absolutely, Frank. Yeah, and one of the things just to mention on the payers fast tracking claim payments. I know specifically right now it is for kind of the fully insured plans, so none of kind of the employee or the employer sponsored plans. So just keep that kind of stuff in mind as you see patients and perform any procedures.
All right. So there's a chance and an opportunity for us to reimagine who we are as providers, and sort of like pivot our locations, our services, if you will, to help supplement what's going on in today's environment.
Yes, I mean, one of those, kind of some of those examples here, CMS expanded the ability for ASC and physician-owned hospitals to kind of assist with some of the COVID-19 response. Under the Hospitals Without Walls program, ASCs can actually contract with local healthcare systems to provide hospital services to kind of lessen the burden on those hospitals that are kind of dealing with the COVID patients. And then they can also enroll and bill as hospitals during the emergency declaration, as long as they're not inconsistent with the state plans. So you can't bill as an ASC and as a hospital at the same time. So you can enroll, bill as a hospital, get reimbursed as a hospital, and then when the state of emergency is kind of lifted, go back to billing as an ASC. Now if you go to the CMS website, they provide kind of many resources around this plan, which kind of spells out the process for enrolling, includes kind of the waiver documents, and then answers to a lot of the frequently asked questions. As part of the sweeping change, CMS is also going to provide regulatory relief on staffing, paperwork, boosting payments to ASCs, and kind of expanding telehealth services, like Franklin mentioned earlier. This is really going to allow surgeons to perform essential procedures on patients without COVID-19 in ASCs that would typically be performed in the hospital. So this includes, trauma surgeries, cancer surgeries. ASCs can work with kind of the local planning authorities to make sure that they provide services that keep patients safe, but not services that would put them kind of more at risk. And along with not just CMS, some states are actually following suit, revising some regulatory controls on hospital services. So Louisiana, for example, the state has adopted a public policy supporting the use of healthcare facilities not traditionally used in the delivery of general acute care, really to kind of augment the inpatient capacity of acute care hospitals. So it allows kind of people to again, perform or step down the service into the ASC rather than the hospital and get reimbursed like a hospital. And for links to specific waiver requests and more details, you can actually see our white paper, which is in one of the handouts that's kind of attached to this webinar, and we'll also kind of be emailing it out to everyone as well.
It's also critical, I would add to that, Pat, that when the claim submission time comes in, that maybe these claims that are billed in electronically also have some type of accompanying correspondence sent to a claims manager or to the insurance company, also reminding them of these state mandates. I think, what we're hearing now is great of the support that's going on, but in my experience, which is also some of your experience also, payers don't always remember mandates or are not always compliant with those instructions as they are placed down by the state. So please be ready to fight for your dollar as we go through this process.
Definitely. All right, so continuing along, telemedicine, and I know Frank, you mentioned this a little bit earlier. But, it's expected to comprise about up to 54% of patient encounters in the near future. It's probably more than a five-fold increase of volumes from prior to the pandemic. So to help boost this ability for patients to have access to care not related to COVID-19, CMS has started to loosen regulations for telemedicine encounters and also said, Medicare will pay for them.
The thing is with telemedicine, it's a challenge. Is again, we need to understand by payer what the coverage issues are, by plan what the coverage issues are, what's required. Again, a lot of the authorizations and utilization management type of processes that were required before our public health issue have been waived, but maybe not all for all payers. So it's imperative during the patient intake process that you do the blocking and tackling of patient accounting / revenue cycle. That is, verify the benefit of telemedicine, ensure that they have it, and find out if there are any pre-visit or at the time of service requirements in terms of authorizations that you have to go through to ensure that you're going to be paid for the services that you're in.
Absolutely, Frank. That's a great point. Yeah. So just to be clear, you're not going to be able to call up, United Healthcare or CMS later and be like, oh, I was on a CollectorX webinar and they told me you'd pay for my services. We are bringing up, some points for you, and there's definitely a link here. AMA's guide to telemedicine, and individual states have different, laws on it. And individual payers and individual patients' plans may allow or not allow for it. So, follow your procedures, get authorizations, make sure it's available before you just start, jumping right into telemedicine for everyone. So finally, kind of the last section is some notes on the CARES Act and some other federal, state, and nonprofit programs that may be available to you. So there are a number of programs designed to support both healthcare specifically and small businesses in general with business continuity and payroll protection. It's critical to execute on these programs sooner as opposed to later. Two great overviews of programs specific to the healthcare sector can be found at the law firms Mannett, Phelps, and Phillips healthcare site, as well as the SBA's CARES Resource Center. So there's the CARES Act small business loans and really the Paycheck Protection Program. Now, the PPP is a loan designed to provide direct incentive for small businesses to keep their workers on the payroll. And the SBA will forgive loans if all employees are kept on the payroll for 8 weeks, and the money obtained is used for, again, payroll, rent, mortgage, interest, utilities, things like that. There's also an economic injury disaster loan emergency advance. So this is a loan that will provide up to $10,000 of economic relief to businesses that are currently experiencing temporary difficulties. This program is specifically designed for any small business with less than 500 employees. Includes sole proprietorships, independent contractors, self-employed people, nonprofit organizations, a lot of organizations affected by COVID-19. There's also the SBA Express Bridge Loans pilot program, which allows small businesses who currently have a business relationship with an SBA Express lender to access up to $25,000 quickly. Now, these loans can provide vital economic support to small businesses to help overcome the temporary loss of revenue that they're experiencing, and can be a term loans are used to bridge the gap while applying for a direct, SBA economic injury disaster loan.
Mm-hmm.
Okay. So there's also the Public Health and Social Services Emergency Fund, PHSSEF. So there's $100 billion in the healthcare sector, included in the act. The first 30 billion is being delivered right now as direct deposits or physical checks based on historic FFS volume. This initial broad-based distribution is going to go to hospitals and providers across the U.S. that are enrolled in Medicare. Facilities and providers will be allotted kind of a portion of the 30 billion based on their share of the 2019 Medicare fee-for-service, again, FFS reimbursements.
Mm-hmm.
One thing to remember: these are payments, not loans, to healthcare providers, and they'll not need to be repaid, which is fantastic. HHS and the administration are working rapidly on additional targeted distributions to providers that will actually focus on providers in areas particularly impacted by the COVID-19 outbreak. So definitely, look out for that. And the HHS is partnering with the United Health Group to deliver the initial 30 billion distributed to providers as quickly as possible. So providers with automated clearinghouse account, or Optum Bank are used for reimbursements, or using CMS. Providers who normally will get that stuff quicker. Providers who normally receive a paper check for reimbursement from CMS will receive a paper check in the mail for this payment as well within kind of the next few weeks.
It's just another example, Pat, of why implementing technology, the transaction code sets, and having a direct deposit associated with your 835 is just critical, because those providers who don't have those things set up are going to be getting their checks in the next few weeks, while others that have that technology at the ready, you get their checks in 7 days.
Absolutely. Lastly, some other CARE Act programs. There's an increase for discharges of COVID-19 patients, increase of 20% Medicare reimbursement for discharge of hospital inpatients. There's a sequestration delay. So the annual 2% reduction in Medicare payments is temporarily suspended, and this is a big one, suspended from May 1st, 2020 to December 31st, 2020. So that's a big thing. And then the delay of the disproportionate share hospital payment reductions. So the CARE Act delayed reductions in DHS payments by 1 year. So these are the payments that are made to qualifying hospitals that serve a large number of Medicaid and uninsured individuals. So the CARES Act funding kind of overview, the nearly $2 trillion relief package, includes $150 billion for hospitals to invest in equipment and infrastructure, as well as small business relief. So we wanted to kind of bring that up as well. There are 55 federal, state, and nonprofit relief efforts and funds to help you through the coronavirus pandemic. There's also the Substance Abuse and Mental Health Services Administration grants. With an application date of April 10th, the timeline is short to take advantage of $110 million there. Again, the purpose of this program was to provide crisis intervention services, mental and substance use disorder treatment, and other related recovery supports for children and adults impacted by the COVID-19 pandemic. There's a couple other here as well, and again, we're going to provide all this information to you through the handouts and through a copy of the webinar.
And the bottom line, right, Pat, is there's a lot of avenues to cash that the government has provided for us, and private companies have provided for providers all across the nation to help keep our practices running.
Absolutely, Frank. That's a very good point. So, through, whether it's the, taking advantage of the government programs through CMS, through either loans, through grants, through advanced payments, or through, the skills we've taught you guys about on, working your underpayment appeals, your out of network, anything like that. There's a lot of ways out there today to try to stabilize your revenue in kind of these tough times. So, with that, I want to thank you guys so much for kind of participating with us today, and stay tuned for updates delivered to you. I am going to take a look to see what questions there are here. Here's a good one, actually. So Franklin, this person is asking, how old, how old of receivable can I still work and expect to get payments in?
Well, that's going to be dictated by the timely filing period of all your payers and your payer mix. So, in this particular time right here, I can tell you what I probably would not do, and that is work on any accounts that are outside of any timely filing period that you have at this time. The effort should be focused in by payer on those collectibles, on anything that you can turn into cash. Those tough appeals like timely filing appeals are going to require people to do a lot of analysis. And quite honestly, it was already a home run wish and a Hail Mary wish in the first place before COVID. It's going to be even tougher now that staffing has a strain on it. So any appeals that are tough to overturn, I would maybe not pay attention to those so much at this moment, and I will work within the timely filing periods. Any receivables that are within the timely filing, I will concentrate on those collectible items at this time. Absolutely.
Okay, great. Next question, with the COVID outbreak, do you foresee any out of network insurance companies processing claims as in network? That's a great question. I haven't heard of anything like that happening, at least as of yet. I mean, obviously, if you are, you're going to get involved in, registering as a hospital, and contracting with your local hospital, those services you perform there would get processed, at the contracted rate from the hospital, because you'd be theoretically kind of using their contract. But I've not heard anything from a standard kind of out of network procedure all of a sudden being in network. I mean, there are obviously emergency situations, so they come into the ED, out of network benefits. Those can be processed in network, but it's going to be really depending on case by case basis.
Yes.
Okay, last question here. What would you suggest we do if we wanted more data to help us appeal our claims? So first and foremost, I would definitely pull data from your current system. So you got to look at all the comps that you have, and depending on how detailed reports you can run, you can start with just kind of the just at the payer level, right? So just at United Healthcare, Blue Cross, Aetna, whatever it is, to figure out when I did a same procedure over these certain time periods, what was that one processed at, and you can use data that way. Outside of that, this might sound self-serving a little bit, so I apologize, but you can contact CollectorX. And so if you contact us, we can, help you put together some data or look at some things that way, or even help you work some of these claims to get you these high reimbursements.
Absolutely. And for those in-network providers, Pat, by the way, I wouldn't just assume that I've been paid according to my fee agreement. I would definitely review each payment you receive, particularly in this particular environment where the staffing at the insurance companies have been cut, and there may be more and more manual processing going on of your claims. Let's be vigilant in ensuring that the payers are doing their part in keeping their agreement in terms of how we getting paid on our services.
That's an excellent point, Frank. I mean, a lot of a lot of providers I've talked to, even in standard circumstances, aren't, diligently, checking their, contract management software, or even just reviewing their patient, the payments on a whole for their in-network providers. Now, with the lack of people over at the payers, I mean, we know, by experience that, Blue Cross is, slowing down some payments. Cigna's have some issues as well.
Yes.
They're ripe for making mistakes, not necessarily on purpose, but just mistakes. And if you can catch some of that stuff, it's a great way to easily get some additional payments in the door.
Absolutely.
All right. Well, again, thank you for your time. I hope you found the session useful. Please feel free to reach out with any questions, or if you'd like any assistance. Again, you can reach us at, you can go to our website, www.collectrx.com, or you can even email us at info@collectorx.com, and we can answer some questions for you. All right. Well, thank you very much. Have a great rest of your day, and we will talk to you hopefully sooner rather than later.
Wash your hands, everyone.
All right. Thank you.
Take care.